So the nicotine receptor, just run back through of the postganglionic neuron. The ACH, we're talking about the parasympathetic portion of the autonomic nervous system. The ACH is released by the preganglionic neuron, which binds to the nicotine receptor on the postganglionic neuron, which causes ACH to be secreted, and then ultimately on the effector is a muscarinic receptor, which ultimately aids or causes that parasympathetic response to take place here. So with a sympathetic neurons, obviously the preganglionic neuron is going to be short, still secretes ACH onto the nicotine receptor of the postganglionic neuron, which with the sympathetic portion of the autonomic nervous system is much longer. The postganglionic neuron is much longer. ACH binds the nicotinic receptor, which causes norepinephrine to be secreted, and the norepinephrine binds to either a alpha receptor or a beta receptor on the effector. So the effector for parasympathetic nervous system, aka the cholinergic receptors, the cholinergic receptors of the parasympathetic nervous system are going to be the muscarinic receptors and the nicotinic receptors. There's two types of the ACH is secreted from the preganglionic neuron onto the nicotinic receptor, which ultimately causes the secretion of ACH, which binds to the muscarinic receptor of the effector, causing the parasympathetic response. However, with the sympathetic nervous system, there's adrenergic receptors. So adrenergic receptors are when the norepinephrine binds to either the, so it goes preganglionic neuron. This is with the sympathetic portion of the autonomic nervous system. Sympathetic neuron, preganglionic neuron, not sympathetic neuron, secretes ACH, which binds to the nicotinic receptor on the soma of the postganglionic neuron, which causes norepinephrine to be secreted by the postganglionic neuron of the sympathetic portion of the autonomic nervous system, which binds to an alpha receptor or a beta receptor. So the adrenergic receptors are when the norepinephrine binds to either the alpha receptor or the beta receptor of the effector. So obviously ACH decreases heart rate and increases digestive functioning, so it's the parasympathetic response. So it has all the parasympathetic response we talked about in a few videos previous to this one. The ACH will decrease heart rate, decrease respiratory rate, increase urine production, increase digestive functioning, etc., etc., etc. Where the norepinephrine will be the sympathetic response. So it will increase heart rate, increase respiratory rate, decrease digestive functioning, decrease urine production, etc., etc., etc. So the cholinergic receptors of the parasympathetic nervous system, of the parasympathetic portion of the nervous system, are going to be the nicotinic and muscarinic receptors. That's where ACH binds to, is the muscarinic receptors on the effector, where the adrenergic receptors for the sympathetic portion of the autonomic nervous system. So ACH is still going to be secreted by the ACH is still going to be secreted, by the preganglionic neuron, where it'll bind to the nicotinic receptor on the postganglionic neuron cell body. But the postganglionic neuron of the sympathetic portion of the autonomic nervous system will secrete norepinephrine, which will bind to these adrenergic receptors, which are alpha receptors or beta receptors. So just running back through, parasympathetic, preganglionic neurons are going to be long, postganglionic short. Preganglionic secrete ACH, binds to the nicotinic receptor of the postganglionic neuron, secretes ACH, which binds to the muscarinic receptor of the effector. That's the parasympathetic nervous system. And then the sympathetic portion of the autonomic nervous system. The preganglionic neuron is going to be short. Postganglionic neuron is going to be long. Preganglionic neuron still secretes ACH, which binds to the nicotinic receptor on the cell body of the postganglionic neuron, which will then secrete norepinephrine. The norepinephrine will bind to either an alpha receptor or a beta receptor on the on the effector, which would cause that sympathetic response. So either the heart rate to increase, respiratory rate to increase, all that at once is going to happen whenever the norepinephrine binds to the alpha or beta receptors on the effector. However, if the acetylcholine in the parasympathetic portion of the autonomic nervous system, if the ACH binds to the muscarinic effector or muscarinic receptor, of on the effector, the heart rate's going to decrease, respiratory rate's going to decrease, digestive functioning's going to increase, and so on and so forth. So if the norepinephrine binds to the alpha or beta receptor, there's going to be a sympathetic response. So all the sympathetic responses we learned about earlier. However, if the acetylcholine that's secreted by the postganglionic neuron of this parasympathetic portion of the autonomic nervous system binds to the muscarinic receptor of the effector, there's going to be a parasympathetic response. So a decrease in heart rate, a decrease in respiratory rate, and so on and so forth.